Hello everybody, and welcome to Tailgate Talk with Dr. Noble. I'm a developmental behavioral pediatrician and clinical geneticist. There's one thing I know about ADHD, it's that it's common. Over the last 10 years in the developmental clinic that I've been a part of, I either talk about it, assess it, or it exists as a comorbid condition in almost every evaluation that I conduct. The use of stimulant medications, the problematic issues that children have within the school system, all of which are often related in some way, shape, or form to ADHD. So, if your child is struggling, I want to submit to you the most important thing to think about ADHD and the strategies involved as we begin. The most important thing to think about with ADHD is impairment. Listen, children are annoying. Children are frustrating. Children are irritating. I got a lot of kids. I got a bunch of kids, okay? I've seen a bunch of kids. I live with a bunch of kids. And if I know one thing, if you know one thing, kids can be annoying, okay? But what you have to understand is we don't treat annoyance, okay? We don't utilize pharmacologic interventions to treat annoyance in a child. We don't manipulate the neurochemistry of a child's brain because they're annoying. We use medicines, we do evaluations, we screen for comorbid conditions and get involved as physicians when a child is not annoying, when they're impaired. Now I'm gonna add in an exercise break. We're gonna do some deep squats. Deep squats, baby. Ooh, that feels nice. Ooh, that hurts a little bit. I got a little back pain. Listen, if you're trying to figure out if your child needs an evaluation, let me save you the 6 to 9 month wait list, the awkward exchange with your primary care doctor, the referral to another specialist whom you may not even like or want to be around. Let me save you some time, energy, and resources by asking you a simple question. Is your child impaired? Because if they're not impaired, I would submit to you that ADHD is not something you need to be worrying about at this point in their life. What do I mean by impairment? Let me explain it. Imagine that you and I are best friends, okay? Because we are. Because this is what friends do. We talk about stuff. Yep. And we buy, better yet, we buy a Ferrari, okay? And we get in the Ferrari and we put in some ACDC and we're just getting ready to blast it. And we get in the car and the car dealership says, hey, look, you better watch out because this car goes 220 miles per hour. And you and I, we say, okay. And we skip it to, the Back in Black album and we get ready to hammer it. And you're driving and I'm sitting in the passenger seat and we're getting ready to go and you hammer it. And that car does 55 miles an hour. And we're in there and we're hammering it and we're listening to the ACDC and out of our left-hand window, we see a grandma, okay, drive past us in a 4-door Chevy Celebrity and we're just like, what is happening, right? We're supposed to be the ones dominating the road. The impairment can best be understood as the difference between what your child should be able to do and what they're actually able to do, okay? And that difference between those two skill sets, what they should be able to do, right? They should be able to sit and listen and build on learned materials and listen to the coach at the game and not bug everybody, including themselves, at church, okay? They should be able to do that, but they can actually only participate or demonstrate skills at a fraction of their ability. That tension that exists between those two things is impairment, and it's not just impairment in one environment. Okay, now listen, not every kid is designed to do super awesome at school, okay? This guy's one of them, all right? It's tough. You have to sit, you have to not think about unicorns, you have to not think about Ferraris, you have to not think about Waukegan sausage. You gotta be focused, 100%. Got a little bit of low back pain. You gotta stretch it out though. You gotta wave at the cars, gotta stretch it out. If your child is impaired, right, unable to perform at their level of ability in multiple environments, let's just say times 3. If they're unable to perform to the level of their natural ability in multiple environments, that's probably impairment, okay? So you gotta think about that. So it's at home, it's at school, it's at daycare, it's at taekwondo, it's at archery, it's at gymnastics, and all the other arbitrary things that you probably shouldn't be doing anyways because you're too stinking busy. Pump the brakes on the Ferrari of life because your kids are only with you for so long. So let me summarize because I don't want to drag this out. How do you know when your child needs an additional evaluation and a referral to somebody like me, a developmental pediatrician or a psychiatrist or a psychologist? The question you have to ask yourself before you begin the process is my child impaired? Let me give you one more idea on how to, I just got scared by a bird. One more idea on how to gauge whether or not your child's impaired. I call it the Nate Noble Grandparents Test. Copyright 2022. The Nate Noble Grandparent Test works like this. If your kids go to stay with grandma and grandpa and they are completely overwhelming to the grandparents and annoying to the grandparents. Now listen, some grandparents are just overwhelmed and annoyed no matter what you do, okay? So we got to correct and control for that. But that's what I'm talking about. I'm talking about the grandparents that say, well, golly, I mean, we had a good time, but I mean, wow, I mean, holy cow, I mean, you should see a doctor. I mean, you should put him on a horse tranquilizer. Like, if they're saying that kind of stuff, they failed the Nate Noble Grandparent Test, and that's yet another example of a child who's likely struggling with impairment. Let me conclude this video by saying something very simple. I'm a doctor, but I'm not your doctor, okay? Everything I'm saying is based on my medical experience and doing this for a decade, all right? Everything I'm telling you is things that I tell my patients, but they're my patients. You're not my patient. If you have concerns about these issues and you believe your child's impaired, continue watching these videos because there's more to say about what happens next. Do a little bit of this. I'm gonna break something. Woo! Thanks everybody for watching this video. I hope it's not dumb.